You may be a person experiencing a bump on the eyelid that has either been there for weeks to months, or maybe you've had a recent inflammatory, red-looking, angry bump on the eyelid that appeared along your eyelid margin. There are two different entities that you may be facing. One is if it's red and inflamed and really angry looking, and if it's relatively recent, it's most likely a stye. A stye is an infection of the glands of the eyelid near the eyelashes. The other type of entity is called a Chalazion. That's called Chalazion. What is that? That's a non-infectious inflammation of the glands of the eyelid, which are sebaceous glands, similar to sebaceous glands on your face that cause acne. So I'm going to explain to you the causes of a stye and the causes of a Chalazion, and then we're going to explore how we're going to treat each one of those conditions. First, let's talk about styes. Styes, as I said, are infectious. There's bacteria that precipitates these infections. They require antibiotics to kill the bacteria and suppress the infection. So that's right off the top. You need antibiotics, whether you're going to use topical antibiotics, maybe eye drops, maybe ointment, but also oral medication like doxycycline, which is an antibiotic that staph is commonly sensitive to. And staph is the #1 cause of having a stye. However, now let's look at the Chalazions. Chalazions are typically non-infectious, as I said. They cause inflammation around the gland by this fat leaching out of the gland. The glands are constipated. They're leaching the material out of the glands. They're all bloated and going into the surrounding tissue. And that fat that gets into the surrounding tissue out of these glands causes a inflammatory response. In the early stages, when you have these Chalazions, they can easily be treated with warm compresses. And warm compresses that I recommend to my patients are just taking a wash towel, wet the wash towel. It doesn't have to be sterile. Put it in a microwave for 10 or 15 seconds until it's warm or on the warm to medium warm level. Take it out. Make sure it's not boiling hot, and apply it over the eyelid area where you have Chalazions. Why do I recommend warm compresses? Warm compresses will help melt the fat. Just like if you put Crisco, which is like solid fat, in a frying pan and turn the heat on, it'll melt. The same principle applies here. You apply heat externally to the eyelid, it'll soften the fat, and sometimes the fat will ooze out of the pores that are backed up and clogged. And that's usually in the beginning. One thing don't do is to squeeze your eyelid. I know there's been a lot of talk about massaging your lids. You can do that, of course, but don't squeeze anything because nothing's going to come out. You're just going to spread that stuff around, and it's going to squirt into the surrounding area and actually cause more inflammation. So I would not recommend pushing or squeezing on your eyelid. In the beginning, you can use also lid scrubs to scrub the lid. These non-irritating eyelid scrubs can sometimes help. But basically, warm compresses will do the trick, along with possibly injections of steroids. Now, you might have to go to your eye doctor, who can inject a steroid around the eyelid cyst. Why do that? Because when you inject steroids, it decreases inflammation, and sometimes by decreasing the inflammation, the glands get less swollen and allows the function of these glands to be restored and allows that fat to kind of ooze out. The fat normally contributes to the tear film of our eye. It's not something abnormal. So fat, water, and mucus are all part of the tear film of our eye. But sometimes when these glands, as I said, get clogged, then they get backed up and then they cause issues. Why does that happen? Well, I think that in most cases, people have hormonal changes where the eyelid glands are sensitive to those circulating hormones. Just like people who have facial acne and they have hormonal changes that are occurring in their body, those glands on the face, which are sebaceous glands, are similar to glands on the eyelid, which are also sebaceous glands, but they're also called something else called meibomian glands. Those glands are sensitive to steroid injections in terms of shrinking them down, allowing the function to be restored into those glands. But sometimes you have to add a antibiotic to the mix to get the gland to kind of suppress some of the glandular activity of the glands, whether it's acne on your face or acne on your eyelid. I call that acne on your eyelid when you get a Chalazion, because it's similar glands. Again, I use similar antibiotics, so whether it's infectious or non-infectious, I'm still using an antibiotic, and the antibiotic of choice in my experience has been doxycycline hyclate, because it's well absorbed into your GI tract and into your circulation. It'll circulate around the eyelid, and it's excellent in terms of suppressing the gland. Now, you have to take these antibiotic pills for anywhere from 5 to 10 days to see any real result, because it takes a while for the concentration of the antibiotic to get high enough to suppress the glands. It's really not to kill off bacteria, it's really to suppress glandular activity. But again, if it's infectious or non-infectious, you still have to take the same antibiotic. Now, some people are allergic to tetracyclines, and you have to use other types of classes of antibiotics that you're not allergic to. So, but in the majority of patients, these antibiotics do very well in terms of suppressing the gland itself. Things I wouldn't do is like put vinegar on your eyelid, or really hot soaks on your eyelid, or squeeze your eyelid, or poke your eyelid, or do anything that you've seen on the internet. I don't think those homeopathic methods are correct. I think that it does require some intervention, commonly from a doctor, to get involved either with steroid injections or oral antibiotics. But in the early stages, you can sometimes intervene and use warm compresses. Occasionally, using things with tea tree oil. There are pads that are commercially made that won't irritate your eye and can be applied to your eyelid, that can kind of help some of the suppression of the glandular activity. Sometimes that does work, but in the majority of cases, in my experience over the last 35 years, I've seen that patients do need some intervention. It's good to pick up this problem early. Don't wait month after month, because the gland itself will change over time. So the glands, those Chalazions, can turn from a kind of a mushy feel to a harder feel, and they almost feel like little rocks. And what's happening in those cases is that the material itself is causing inflammation on the eyelid, and the eyelid has then stimulated fibroblasts to come in and create like little scar tissue in the eyelid, and that's harder to reverse. So in those cases, sometimes we have to make incisions in the eyelid by everting the eyelid over a clamp. We have to make vertical incisions, and then we have to curette the material inside the gland to accelerate the resolution of the problem. And occasionally we have to inject steroids as well as something called 5-FU, which is an off-label use of a drug to reduce scarring of the eyelid. Some people are prone to having recurrent Chalazions, whether that's a hereditary propensity or whether that's just a individual sensitivity to the hormones that are circulating in their system. I don't know, but it's a problem that can be controlled, especially if you do early intervention by injecting and using warm compresses. Usually we can suppress these problems before they require any surgery to curette the material out of the glands. I've given you a comprehensive guide to differentiate between Styes and Chalazions. I hope this is helpful, because I know this is a common problem that distresses a lot of you out there. And if you have any further questions, please leave them below. I'm more than happy to answer the questions.